Good morning, everyone. Welcome to Pediatric Grand Rounds. Thank you for joining us online. As always, we are in the Mill Mountain Conference Room at Tanglewood Complex. Please come down and join us in person if you can. Today's speaker is one of our own third-year residents, Dr. Dylan Campbell. He is a graduate of Virginia Tech's class of 2019 in microbiology and immunology. He attended medical school in VCOM, graduate in 2023. His hometown is Grundy, and he plans to return to Grundy, Virginia to practice as an outpatient pediatrician. He's a fan of the sci-fi genre, and he has two cats named Khaleesi and Thorn. Please join me in welcoming Dr. Dylan Campbell.
All right, thank you. So this morning, one thing I wanted to talk about was something that is very personal to me and very near and dear to the reason I went into medicine. I wanted to talk about kind of the whole healthcare landscape of Southwest Virginia. As Dr. Permeshwar said, I grew up in the region, plan on working in the region, so this was very near and dear to my heart to go through. Unfortunately, I have no financial disclosures. I did want to make a disclaimer. Some of the topics that are covered in this can be considered political in nature, but I don't endorse any certain topics or ideas with this, just more trying to present data as I could find it. Objectives for this, so we're going to go through, starting off looking at some demographics as well as the socioeconomic factors of Southwest Virginia, look at with the poverty, food insecurity, access to care, look at access with subspecialties as well as just board certified pediatricians, and then see how Southwest Virginia is comparing to the rest of the state itself. So to begin with, I want to just, for the sake of this talk, define what I'm meaning as Southwest Virginia. There are multiple definitions. There are, the Appalachian Regional Commission has their own definition. For this one though, I decided to go with the Virginia Health Department. They have multiple districts. I thought that was going to be the best way to define the region in this. So Southwest is going to include us here in Roanoke, Allegheny, Central Virginia, the New River, Cumberland, Mount Rogers, West Piedmont, Pennsylvania, and Lenausico. So just in mind, that's what we're going to use. You may see other definitions of Southwest Virginia out there though. So to begin with, let's look at our population demographics, kind of what we're dealing with. Now, I know most of us in this room are very familiar with this, seeing as how this is our patient population, but I will say Roanoke is a little bit more of an outlier in the region itself. So looking at our pediatric population, I actually have listed every county in the region and how many children are under the age of 18 with that. So if you look at the entire region together, you have 253,712, which is accounting for about 13.5% of all of Virginia's pediatric population. You keep that in mind that is Roanoke's and catchment area, and that's not even including some of our eastern reaches. So Carilion itself is serving about 15% of Virginia's entire population with that. Our age distribution for the area, as you can see, tends to lean a little bit older than the rest of the state. Our 65 and up is a little high, is higher than the rest of it. Though surprisingly to me, the under 18 is about on par for the rest of the state. I kind of expected that number to be a little lower, but looks like we're actually holding steady there. Female to male ratios looking about the same, 51 female, 49 male. Again, that's looking equivalent across the state as well there. Ethnicity does tend to fall a little bit heavier on the Caucasian white side. The state overall is a little bit more diverse. You come into this area, you start getting a little lower. We know here in Roanoke, our Hispanic population, we have several Spanish-speaking patients, and when you actually break down the data going by county, Roanoke is attributing for most of this 4% in the region. So some of the numbers I start looking through, I take Roanoke out, and these numbers start going even more heavily skewed in that direction. When you look at high school graduation rates, you can see that these are actually more recent numbers, not necessarily just with adult educations, but just our 4-year on-time graduation rates currently ongoing. And unfortunately in Southwest Virginia, you do see a little bit of a decline, 84.3 as compared to 92.5 with the rest of the state. You'll see that in this presentation, I compare a lot of things to the rest of the state, which I think just kind of gives us a good benchmark. Virginia is one of those where you have so many different regions. You have Northern Virginia, South Side, you have the Tidewater region. I thought it was very important to see kind of part of the disparities with that is seeing that in a state that ranks about 13th in total GDP in the entire country, how much with our region, you're still seeing numbers that don't necessarily line up with that. So a lot of the things that you're seeing are out of Northern Virginia. Those are tanking the numbers up entirely. So I think it does give a better sense. A lot of the data that you find is state by state data. So when you just look at the state of Virginia, it doesn't give the full picture there. So a lot of this just kind of looking through, so the median household income is going to be about 28% less than income. And then if you look at that, it's 45% lower than the rest of Virginia. Again, you look at poverty rates going at 19.2%. That is about 8% higher than the rest of Virginia. On disability, you're going to have 9.3% of the entire population on disability benefits. Going back to the education key, a lot of the adults, so our parents of the populations, only 56.4% have any sort of associate's degrees, undergrad, 4-year education. And if you look at the rest of the state of Virginia, we're clearly lagging behind in that, 68.7% in the rest. And then social associations, which I thought was interesting. This is more looking at families, communities, church, things like that, connectivity. You actually do see that our populations in Southwest Virginia have a lot higher percentage of social connections, 39% compared to 17% in the rest of the state. This data is coming from the Appalachian Regional Commission. I just thought that was interesting. You know, it's not all doom and gloom with everything. You do have a lot of benefits. I did grow up here, and that is one of the things that I have always thought is one of our strengths, is a lot of the people are helping take care of each other. So despite a lot of these disadvantages, there are other aspects that have been helping even with raising children. Going from there, let's start on some of the economic factors, which is playing a large role in our health with our populations. As you can see here with the map, I know this pointer is not going to work, but I'll try. You kind of just see a gradient, and I hope you all like maps because this is going to be a large portion of this presentation. I like my maps here. And you're going to see a kind of recurring theme with this gradient idea as you come down here. So this is where I'm going to be coming back and practicing in my home county, Buchanan County. You're getting towards, with that, it and Dickinson County are the two poorest counties in the state, and you're getting at 33,905 median household income. As you can move throughout the state, you can see that goes up upwards of 156,000 once you get more eastern into it. So a large disparity there with that. This is also just kind of showing it in a different format, showing the amount of families that live below the poverty line as defined nationally with that. And again, you see this gradient that I've been talking about. As you come further in the Southwest Virginia, it just becomes so much more stark with that. Another good indicator of poverty is free and reduced lunches. So growing up, you know, I remember I think almost everyone in the school got access to free lunch, whether or not you qualified for it. But looking at these numbers, so it looks like, if you remember, I said we're sitting 200-some thousand kids in the area. 170,000 of those students are qualifying for free and reduced lunch. But in other terms, that's 4 out of every 5 students in this region are going to qualify for either reduced lunch or free lunches. With that, so you're getting about 80.5%. That is sitting 37% higher than the rest of the state with that. One of these things that it's a good indicator for like food insecurity, it's another indicator for poverty in the area. This is just going over kind of that information as well, what it means. But it's not the worst thing. You know, it's actually good that we're able to help children in this, because having healthy meals, as we know, going to help with health indicators. Obesity rates in the region, while I could not find exact data just for this region itself, we know from seeing our own patients, it's very high in this region. But if we can get access to healthier meals, that does help decrease some of that. We can get better nutrition with them. And then I also found a study that showed these free and reduced lunch programs, they can help reduce poor health rates by 29% and can even help reduce obesity by 17%. So not, you know, it is an indicator of the poverty in the area, but there are things that are being done to try to help reduce some of that. It does help improve school attendance. I can speak anecdotally. I know during COVID, a lot of the school systems were setting up buses and systems to get food, because a lot of children, this meal that they get during school is the only meal that they'll get throughout the day. Coming from that, going from an insurance standpoint, you know, we see here in Roanoke, our numbers are a little better with our Medicaid. But if you look at Southside, so that's this is Martinsville, Danville, right through here. And then coming in as you go further out, you're getting up close to 50% of your entire patient population requiring on Medicaid. Going from that, as we know, Medicaid funding has been decreased throughout some. This project right here is actually coming from Senator Markey that was presented to the Senate, I believe, showing what projected losses will look like in funding. Now, if you actually look at it, Northern Virginia is going to bear the brunt of that loss of Medicaid projections, and fortunately not as significant through here, but when you start looking at that proportionally, there's still a significant decrease in funding for our Medicaid patients, which is going to have a lot of impact with that. If you look at this map right here, this map is showing all of the hospitals within the state of Virginia. So these are not pediatric hospitals, but as you can see, it looks like our South Side and Southwest Virginia are the ones with the most at risk for having hospitals closed down over the next 10 years with that. One of these is actually Carilion owned hospital in Tazewell, and it was identified as one of those at risk just based upon the percentage of Medicaid patients that they are seeing with that. So coming from that, let's look at the actual current health landscape that we're seeing in this. This slide to me was quite powerful, I thought, when I was looking at this. This is looking at health life expectancy with it. As you can see, as I mentioned, gradients are going to come greatly once you get into the Southwest Appalachian region. Your life expectancy is going to decrease. If you look, this red spot right here is where I was born and grew up, spent most of my life. And then you look up here from Nova, a child born in the exact same place I was born is expected on average to live 15 years less than a child born in Northern Virginia. According to this, I have about 72 years as my life expectancy compared to 87 compared to our eastern side of the state. And as you can see, it's not just Southwest Virginia, but Eastern Kentucky, West Virginia, and parts of Eastern Tennessee that you're seeing with that. I thought that that is another driving factor, is one of the reasons why I did want to go back to my hometown with this, is seeing this kind of data just kind of makes that stand out to me. So let's look at access to care, some of the factors that are playing into these data that we're seeing with life expectancy. So the AAP actually provides a list of every board certified pediatrician across the country. You can actually look at this data based county by county. As you can see, Roanoke and Roanoke City is playing the largest role, is the largest amount of board certified pediatricians in the entire region. One thing that I thought was interesting, so here's where we are sitting here. We're sitting at 19 board certified pediatricians in the city itself, 23 in the entire county. This is Blacksburg, this blue dot right here. You cut that off and go further into the state. There are 17 board certified pediatricians serving every county in this part of it. Buchanan County, again, has one pediatrician. He is 84 years old, was my mother's pediatrician, my pediatrician. Plans on retiring within the next 6 months once I get back there. So those numbers will not change, but he is serving Tazewell County, Dickinson County, not to mention McDowell, West Virginia, as well as Pike County and Kentucky. So not only are we seeing that with Southwest Virginia, but it's the entire region itself with that. As you can see here with the numbers, most counties are seeing a very small very small amount of actual pediatricians. Now we do have nurse practitioners and family medicine doctors that are taking into that and are helping with that, but as far as just board certified itself.
When you looked at the ABP numbers, did it break out, or did you notice if there were subspecialists broken out? Because some of the subspecialists keep their...
Yeah, so if we come on to this next map, you can actually find every single pediatric subspecialty. Now, I thought about breaking that down by each one, but then we would be in here forever, unfortunately. But if you look through here, obviously, Roanoke is playing the majority of this. The numbers, and actually the map does not do this justice, but this is Washington County right here. That's only sitting at 3 subspecialists in that region. It's just the numbers are so much lower with this. That's why the numbers come across there. So Roanoke City is the subspecialist hub for this entire region. You do have some come down in Niswongers out in Johnson City with that, but as you saw earlier, our Medicaid patients with that population, a lot of times those will not cross state lines. Yes?
The blue at the very bottom, is that Holston Valley? Is that Bristol?
Yes, yeah, Washington County, Bristol right there. So this little white dot is Bristol right here, and that's going in Abingdon, Holston Valley, Johnson Memorial region with that. So as you can see, most of the region itself, the travel time for this, if you're coming from Smith County down here over to Roanoke, that's going to be about a 5-hour drive for you. A lot of these patients are looking 1 to 3 hours at a minimum just to get to a specialist. Now, fortunately, our children here in this area, they, I do find it funny when we call Rocky Mount our rural pediatrics because they are 30 minutes from many of our specialists. Having grown up where I did, that is not rural to me. But I think that just shows what importance that this has to the region with it, just even providing access to that. You're requiring a lot of telehealth reliance. Now, you look at the rest of the state, you're getting Charlottesville, so UVA, you've got Inova Fairfax, you're getting VCU out in Richmond, you've got EVMS down in Norfolk, so, a lot of more access points. Now, obviously, our patient population in this region is only accounting for 13% of that, but still, getting that travel time is going to be really hard for a lot of these families that are already below the poverty line. Traveling 3 hours for a lot of them, that is going to require them to take a day off work. It's going to require transportation. It's going to require gas money. And that's a lot that some of our families cannot afford to actually do with this. So looking at this, that's just going into this geographic, but it's going to lead to our patients are not going to get to Dr. Temez for their asthma treatments as much. We're going to get poorer control rates. We already don't have enough board-certified pediatricians to take over for every single one of those. GI disorders, epilepsy, getting here for neurology, our cancer patients coming out to Dr. Borowitz are still going to have to come a long way for that. Another factor that I wanted to look at was vaccination rates. The Virginia Department of Health provides a lot of these data. As far as childhood vaccinations, though, for some reason, the main data factors that we have are the MMR vaccines. I wanted to look at this. So this first graph I'm showing you is showing 7-year-olds in the entire state of Virginia. So the reason 7-year-olds were defined in this is because they are the ones that are likely to have a complete series of their MMR vaccines. If you look at the entire state, we're sitting at 86.2. The numbers down here, and you'll notice me talking about Buchanan County a lot just because that is going to be fresh on my mind. But you are looking at, I believe it's 58% of 7-year-olds have completed the MMR vaccine. 58.3%. If you look through here, this is now 2-year-olds at the same point, and that number is dropping to 45.2%. So we're seeing, not only are we seeing lack of access, but we're now seeing decrease in vaccination rates with that. I thought that was a pretty stark decrease, about a 13% decrease in the amount of kids who had completed it, and now we don't even have that many starting the first dose itself at that point. The numbers here say less than 75%, but if you start going into the county by county data, a lot of them are more like Buchanan County in that, sitting in the 40%, 50%. So our vaccination rates are declining in the region, which is only going to worsen a lot of these health outcomes for them. You can look at here for some of our more teenage populations. This is looking at meningitis. Across the state, not quite as robust, but still you're seeing decreases in Southwest Virginia. One thing I thought was interesting, now when you're looking at this map, the numbers look great, but just make certain you look at the images on the side. This is for RSV vaccinations under 1 year and then mothers who got it with pregnancy. So most of the state is sitting above 12%. So this is one that the region is not falling behind on. We're actually staying with the rest of the state as far as RSV vaccination rates go. I thought was an interesting data point, just considering how we're not getting mumps, measles, and rubella, but we are getting the RSV. Now, I don't know if that is how it's being marketed as an immunotherapy rather than necessarily a vaccination, but I just thought that was an interesting data point out with that. Maternal and infant health, this is something that I think is a good indicator for childhood health rates. And one of the easier numbers, because the Appalachian Regional Commission puts out these reports, this was the last report that they had placed, so I apologize for some of the older numbers. But if you look at this, infant mortality rates in Southwest Virginia are per 1,000 births, you're sitting at 7.3 within Southwest Virginia. That number comes 6.6 with the entire state. And if you take Southwest Virginia out, it's 6.5. So 7.3 to 6.5 per 1,000 births, your infant mortality rate is much higher on this side of the state. Low birth weight as well. So we see a lot of patients here in our NICU with that. You see the numbers aren't as drastic with that one, 8.7 to 8.2. And then teen birth rates, this is where you see the most drastic numbers changing there. You'll have, for every 1,000 females aged 15 to 19, you're going to end up with about 40 teen pregnancies compared to 26 with the rest of the state. Now, I did have someone ask me when I was going through this data, they said, now isn't this a more religious area? Does that not seem to be a little bit more counterintuitive? Unfortunately, with that, you have lack of access to sexual health education. There's, as much as we can say abstinence is the best way to prevent teen pregnancy, unfortunately, that does become somewhat naive at times. A lot of these teenagers, one, they don't necessarily know the consequences of their actions, and two, don't have access to birth control or prophylactics, things of that nature. The infant mortality rate is 20% higher in Southwest Virginia. Low birth weight, about 8.7%, is so on average with that, but our teen birth rate is 50% higher in or 50% higher than the rest of Virginia with teen birth rates.
Dylan, does that correlate with teen pregnancy?
I'm not exactly certain. I couldn't find the full data of how many were actually carried to term with that. Like I said, sometimes it was a little hard to get data that was just exactly pinpointed towards these specific counties with it. So I'm not certain, but that is a great.
I just wonder if the
How many are
pregnancy
actually-
rate is that much higher, or if it's the people who keep the pregnancy.
That is a great question. I'll have to look a little bit more into that, so I'm not exactly certain, but I do like that line of thinking with it. Coming through here, neonatal abstinence syndrome. So, we see a lot of children that are withdrawing. This number right here in the entire state, my home county, as well as leading by a significant portion with children being born with NAS at this point. You're seeing 60 for every 1,000 births at that point, requiring hospitalization and treatment with morphine, things of that nature for it. So that is just showing as well just how high drug rates actually are within the region. You're having a lot of families that are on Suboxone clinics are a dime a dozen throughout the region, opioids making a large majority of the drug addiction rates. Now, I know our children are we're not seeing that rate necessarily with our population, but the fact that the families, caretakers, and things of that nature is going to greatly impact their health. This is just looking at a map of just where adverse outcomes with births. As you can see through here, this one's actually fairly uniform across the state. It's more to the south side of Virginia that you're seeing these larger numbers with that. So still seeing it, however, in Danville and Martinsville area that we are covering here. This is looking at birth defects, which I thought was very interesting because Southwest Virginia actually is leading the state with that. Now, I don't know if that is just due to a smaller population in the region, but the number of birth defects within the region is much lower than the rest of the state with that. Again, looking at sexually transmitted diseases, chlamydia rates, again, lower in Southwest Virginia. Which I thought was interesting because that makes me wonder how many people are actually getting tested. We saw the access to care with that. So is that these rates are actually lower, or are we just having people not having access to care? You'll see the exact same trend with gonorrhea rates. And then congenital syphilis is also much lower in this region. So either the data is showing that STD rates, despite having teen pregnancy or teen birth rates being higher, the STDs are lower. So that's making me think, with all of the data that I've been looking at, that it's very possible that this is just because we're not having people being regularly tested, seeking treatment, which ties into the access of care that we've been talking about. Behavioral and mental health. So I also, not only were we able to find board certified pediatricians, but also looking at child and adolescent psychiatrists. The entire amount of CAPS that serve the area is about 35. When you look at that total population, so that's 35 for 253,000 kids. That ratio is sitting at about 1 to 7,000, but I got curious if you took Carilion out of that data set, and that goes from one child and adolescent psychiatrist for every 7,000 kids to 1 to 11,000. So that just kind of highlights the role that Carilion is playing with this region. Even though it is on the outskirts on the right side with it, if you take it out, the health, the access just goes down even further, just kind of highlighting the importance that we're having with this. You can look at the Virginia Self-Harm Suicide Report. So this was placed by the Virginia Health Department. ED visits for suicidal thoughts. Southwest Virginia is second in the state when you break it down by region. Non-fatal Self-harm hospitalizations, still actually on the lower end, about third out of these 5 different regions with the area. But when you come over here, the repeated suicide rates are actually the second highest in the state. So we're not seeing as many hospitalizations that were non-fatal, but we are seeing more fatal suicides ongoing in this region. This is having a lot of, with the lack of mental health resources, will have kids that are delayed getting ADHD, autism, diagnoses that could be helped with school that are going on being undiagnosed with that. Now, I know out here, a lot of times schools are running their own evaluations with that, and that is helping pick up some of the slack, but not all of our counties have the resources and capabilities for that. Just looking at data, I saw a football stadium built in Fairfax County. They spent more money on that football stadium than my home county's entire operating budget for the year, for the school year. So, you know, as much as the schools are trying to pick up slack for these, a lot of times they don't have the resources to actually be doing that. We are very fortunate here in Roanoke to have school systems that can do ADHD and autism screenings like that. So now that I have significantly depressed everyone looking at everything, what are some of the things that we can do, you know, looking at moving forward? Now, if you'll allow me to be cheesy into this mirror, every single person sitting in this room right now, every person listening on this is contributing to the health of this region. Each and every one of you has decided to either stay here and work in the area or come do your training here. You all are making a difference. As you can see, you know, when I took Carilion out of those numbers, it gets drastically worse. So each and every one of you are help serving this. And I think that that is a great thing that as much as the path forward, I wish I had the answers for what we can do for this. Our locations through here, so we have VCOM students with us, we have DTC students. The University of Pikeville, KICOM is also having students coming through. We have the West Virginia School of Osteopathic Medicine in Lewisburg, and then the East Tennessee School, which is an MD program. But I just was starting to go through all of the mission statements of these schools. Almost every one of them, you can see areas in here that are bringing up to serve the Appalachian region, to serve these communities. So every one of our students coming through, they're helping contribute with this. Now, what I would like to see is a lot of those students stay. I know every one of us that have applied, many of us in our own residency program went to several of these schools. And I would say just about all of us spoke about a desire to help with rural healthcare at some point with that. So hopefully we can continue to see not only that as part of the application process, but actually seeing that in practice and getting a lot more people into the area. Coming back through here, some of the things that you're seeing, telehealth is helping increase access. Now it does have its downsides. We can't get full physical exams with that. You're not actually having face-to-face, but with a lot of our specialists, some of the behavioral health there, just being able to do some of these follow-up visits without having to travel the 3 hours, 5 hours to see someone. There is the Southwest Virginia Telehealth Alliance. They are working on setting up things with that. I know Carilion has been looking into potentially increasing our telepediatrics as well. And then you'll see local community-based things. So the Virginia Health Department is setting up immunization outreach programs. There's a lot of faith-based programs in the area looking to help with food insecurity. There's even I saw some localities are setting up transportation systems in addition to like our Medicaid cabs that we see a lot of our families using. Several outside organizations are trying to help set up transportation to get people to and from their visits with that. So we have a lot of work to do with it, but coming here, one of the main reasons I wanted to do my training here at VTC was because this is the referral area. This is one of the premier pediatric things in the region. So each and every one of us standing in here has been working to combat this. Now, clearly, we have a lot on our plate, and it's a lot for the amount of us that are here. I know our specialists, we have wonderful specialists, but even then, the numbers are still getting high with that 1 to 7,000 for every child and adolescent psychiatrist. Still a significant number with that. But we are seeing some returns made on that, and I think that is just really wonderful with our families. With that, if it's okay with you all, I'd like to just go into some board review questions. You can imagine going through a lot of our Peds in Review, things like that, don't have a lot of questions specifically tailored to Southwest Virginia, so bear with me on some of these questions. But so with this one, social determinants and pediatric outcomes, which of the following social determinants is most strongly associated with an increased pediatric asthma exacerbations and emergency department utilization in areas such as rural Southwest Virginia? So A, a lack of access to pediatric endocrinology services, B, transportation barriers limiting access to primary care follow-up, C, high rates of private insurance enrollment, or D, increased availability of school-based athletic programs. I didn't make these that hard for you all.
B.
Excellent, wonderful, yes. Transportation barriers are a huge thing, as we were talking about. A lot of these families are not going to be able to make these drives. So you are seeing, you're going to have people coming to the emergency department for things that probably could have been taken care of in an outpatient clinical setting. You're going to get more utilization of that. You're not going to get refills quite as often with it, so they're not going to have, say, their control medication and things of that nature. So with this, which intervention has demonstrated the strongest evidence for improving access to pediatric behavioral health services in rural Appalachian regions? A, increasing referrals to out-of-region tertiary academic centers. B, direct-to-consumer behavioral health smartphone applications without clinician involvement. C, integration of telebehavioral health within primary care practices. Or D, annual community health awareness campaigns.
Easy.
Excellent. So coming in with the telehealth, that is going to be something that we see try, especially now after COVID, we've seen a large expansion with that. And while it does have its downsides, it is going to help at least get some care for some of these patients in the area. And then lastly, which policy level intervention has been associated with improved pediatric preventative care utilization in rural Medicaid populations? A, reducing Medicaid eligibility renewal frequency to every 6 months. B, expanding Medicaid coverage and simplifying enrollment processes. Or C, limiting coverage to emergency services only. Or D, increasing co-payments for preventative visits. Excellent. So Medicaid expansion, as I said, some of these topics are political. I endorse no one way or the other. I'm just trying to present data as I could find it with it. These are my resources. Collecting this data came from a very wide array of different websites, databases. So I cannot say I did not have AI look through a lot of these. You can, as a just kind of blueprint, you can upload, you can download a lot of these data files. They'll have county by county for the entire country, and then you can have that to come through finding a lot of this information. So I had to go through the AAP, Virginia Department of Health, CDC itself, and then as well as the Appalachian Regional Commission. All right, so with that being said, any questions? And I will just state, as much as I have tried researching into this, I'm not yet a full expert on the entire health landscape, but we'll try to answer it to the best of my ability.
Dr. Harmon, you got something?
I sure did. Great talk. You really did a great job highlighting, I think, the real issues facing our kids in Southwest Virginia. I apologize, I'm not there. I'm in the airport. But question of, so what do you suggest that the folks on this meeting can do individually, right? As an organization, we will lobby and do everything we can. But what can the individual physician do? Or what should we do?
Yeah, so that's a great question. Clearly, you know, as I said earlier, each and every one of you have chosen to be in this region with it. You have made the choice to come back and serve this area. I can only speak, I can't tell you all what to do, but I can only speak for myself in that. It's very easy for all of us to go take a job somewhere else that probably would have 19 other pediatricians within the practice. You can go through and have a lot easier lifestyle. But this dedication to it, I myself have decided to go into a practice. Like I said, pediatrician is 84 years old. He was my mother's pediatrician, was my pediatrician. I expect him to retire as soon as, maybe a few months after I get there. But, you know, coming into the region and trying to make a difference, it's going to be hard. I can't say that this is an easy fix to go around, but just being able to come into and go in where, meet our patients where they're at, coming in, trying to help with them. As much as, you know, one person is not going to stem the tide, but each of us working together with it. As you said, you know, I know Carilion from a facility system standpoint is going to work with that, but just each one of us trying to expand as much as we can, getting into the regions with that, I think that is very helpful. I know a lot of our specialists are trying to expand westward to decrease travel times, but we can still even go further. You know, Southwest Virginia with it, I get all the time that, oh, you're from Grundy, you're basically a local. And I'm like, well, as much as a local from Richmond is, it's 3 hours to Grundy from here as much as it is 3 hours to Richmond. So yes, I am a local to the region, but we still have a long way to go in that further area. But great question, Dr. Herman. Hope I was able to answer that somewhat, but.
I have a comment.
Of course.
You touched, well, one thing that's really important for child health, in addition to our care, is dental care. And I did locum work in northern Maine before fellowship, and kids would come in and just have all their teeth pulled because there was no dental care, and you just couldn't have abscesses and things. And I noticed here that very few of my patients have been to a dentist. And I ask about dental care because it's important to kidney health. And not only do they not go to the dentist, but they don't even brush their teeth. And so anybody with, you know, you could give anybody a toothbrush and toothpaste and educate them to brush their teeth. And I have no idea where I'm going with this, but I'm also super excited about having a pediatric dentistry residency starting here, which I think is going to expand that access. But you have to think about, if you don't have healthy teeth, you can't eat healthy food, and that kind of leads down a whole path of eating mushy things, like.
And not even, you know, I can speak anecdotally to this, but, you know, growing up, you would see kids with caps all over, on every teeth. Some families giving, they'll put Mountain Dew in a bottle and give it to their kids. I can say a lot of it from a primary care physician, you know, education. we might not be dentists. I think it's great that we're having this expansion with it, but we can help educate. I remember seeing a child with a dental abscess in the ED. I think it was either my intern year, and just speaking with the mother, she had 6 kids, and she made a comment to me. She's like, you know, I've noticed something. My kids that like sugary drinks seem to be having more dental problems than the other ones. But as funny as I laughed, you know, at the time, but then I thought about it. I'm like, this woman actually did not realize that these were having an effect on her child's health. Yeah. You know, a lot of this, you know, we saw the education rates, you know, once you get to our pediatric graduation rates, all still lower or higher than they used to be. A lot of the parents and things like that, they're doing their best for their children. They don't actually just have the knowledge or data, and that's where we can play a large role in this. You know, we might not be prescribing medications for everyone, but just sitting down, talking with them, helping educate, coming from a non-judgmental area for it, you know, just because they don't know these things. It doesn't mean, and I've always thought this, education does not equal intelligence. just because they might not know these things does not mean they're dumb, does not mean that they are not smart or capable. It just means nobody's taught them. You know, if they've not learned it, then they're not going through. And that's one thing I think we can, as physicians, make a difference in with that, is just trying to help educate as much as we can on health.
What you said, meet them where they are is critical.
We do have a dental program here where we give out toothpaste and toothbrushes because of this access and knowledge and risk assessment. So that's been recognized. And if you want to count how many dentists there are in Roanoke for children, and then put a finger down for who takes Medicaid and who has opening, you'd be left with a very amputated hand. So it doesn't, there's not many. So the burden is really back on primary care, pediatricians, family practice. And I think the way I train and where you guys are now in terms of the additional things that we do as pediatricians to try to bridge that access gap is huge, but there's tons of work left to be done.
Even dental care within Roanoke is a problem. If you look in the Roanoke Mommies group on Facebook, every other post, I feel like somebody's trying to find a dentist for their kid in Roanoke.
And Dylan's going to be counseling, drink mostly water. Because
And you're talking about dental care in Roanoke being hard to access. If you think it's this hard in Roanoke, imagine trying to find a pediatric dentist in Grundy. It does not exist. Yes, Dr. Gagan.
One other thing I would just throw out is I think each of us has an individual responsibility to represent our culture as physicians, as medical providers, to our representatives. The new candidate for Surgeon General was on the stand the other day and talking about how she, as a physician who has never practiced, really thinks that each parent should talk to their doctor about the risks and benefits of each vaccine, which is like a medication, which it is not, right? So I disagree with her, and I would encourage all of you to write to our new governor and the new people who are in charge of VDH and to really ask for the public health that we deserve. I am happy to be working here and having individual conversations with individual parents when I say each kid is different, and does your kid need a VCUG or not? That's a detailed decision, but does every kid deserve to have a flu vaccine? They absolutely do, with very, 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 very few exceptions, right? And so I think for us to be open to those conversations, of course, is important. Informed consent is critical, and yet public health is getting very confused with primary care access, which we know is limited. And so for all of us to write to our representatives in the state, but then also federal, and say, you are asking way too much of an individual pediatrician to educate each parent on each vaccine at each visit. And the result is going to be pain and suffering for our children, which we don't have the capacity to care for. So I would just encourage you, in all your spare time, there are often websites that have a pre-written letter that you can go to. I don't want to be politically divisive and tell you which one I use, but come find me, but to write a letter.
All right, so with all of that, I just want to end with thanking each and every one of you. As somebody who's grown up in this region, it means a lot to see all the work with a group of people who have dedicated their lives to helping with this. So just want to thank each and every one of you. All right.
Dr. Tiffany, you got a question?
I was just going to comment. I'm very similar to Dylan in that I was raised and grew up and have lived in this region my whole life. And to echo the fact that Dr. Gagan just brought it up, like in all of our spare time, sometimes the most impact we can make is with that one person in front of us. But that means it's hard, right? None of us have a plethora or a well of extra time to add on. And so I too would love to say, like, I think what we're doing is hugely important. This is a talk that when it loaded, I said, oh, I feel like I could stand right up there with Dylan and talk about a lot of the struggles for Southwest Virginia. I mean, I grew up in Norton. I went to school in Wise County, and I had the only pediatrician in town, and I don't think I saw a dentist until I was over 8 years old. So, just every little bit that what we're doing with those families in front of us, but we can't create more time. And I think every single one of us would like more of that, but what we're doing does make a difference. I had a family last night while I was working at Tanglewood tell me that much. And it felt really good to have a family take the moment to say, hey, we're really grateful for what you guys are doing. So while this talk is hugely important and vastly, again, like Dylan said, not going to turn the tide with a single individual of us, but if we're all doing the same work, then we're definitely going to get there eventually. So thanks everybody for what y'all do. Great talk, Dylan.